Just seeing what I look like in the mirror now, I'm actually like I'm happy. Before my transition, it was very hard for me. Always say this, like I used to cry to myself because I was not happy with what I was looking at and I just hated my body. So being able to internally feel this way and just look at myself and feel this connection, it's very soothing. It's definitely a huge weight lifted off my shoulder, so it's definitely a great feeling. I hated how I looked, so I hated taking pictures. Now I love how I look and I'm taking pictures of myself all the time. People, maybe it comes off as like a little cocky, but in reality, I'm confident with who I am. I've worked hard to be where I'm at today, so I'm not gonna like be afraid to show it off and stuff.
All right, everybody, welcome back to Club Nurse. I have an amazing guest here with me today that I'm super excited to chat with you guys about. But this is Liam. Liam has been breaking social norms since his coming out in 2017. A self-made transgender man born and raised in Syracuse, New York, where he grew up navigating the complexities of identity, faith, and community. A former athlete and lifelong competitor, basketball was his refuge throughout childhood and college, until a deeper calling led him to embrace his truth and begin his gender transition in 2019. After nearly a decade and a half of personal evolution, Liam completed his medical transition in 2025 and now uses his platform to inspire, educate, and empower. As a social media influencer, he shares his journey not only as a transgender man, but as a human committed to self-growth, mental resilience, and authenticity. Liam's story is rooted in contrast, from being raised in the church, combating negativity and hate on a daily basis, growing up both popular and quietly struggling with his gender from a young age. His voice is raw, real, and deeply personal. Backed by a strong, outspoken, and loving family, he brings honesty and heart to every conversation. Through storytelling and fitness, Liam has become a source of strength for thousands, showing that transformation isn't just possible, it's powerful. So everybody, welcome Liam. Thanks for being here with us today.
Yeah, thanks for having me. Appreciate it.
Of course, yeah, I'm super excited to kind of dive into this conversation. As the podcast is called Club Nurse, so it's not only based around nursing. Obviously, you're not a nurse,
Yes.
but I like to have people on just to share their experiences, their life, their stories, and I think you specifically can really offer the healthcare community kind of a lens into what it's like being on your side, getting these medical treatments and going through these transitions, and how the healthcare community, as far as doctors, nurses, or anybody, can better support people like you that are going through these transitions a little bit better. So, if you don't mind, if you could just kind of start from the beginning, give us a sense of what it was for you growing up. And I hate the cliche question of like, when did you know? Like, I hate when people ask me that about just being gay. Like, when did you know? I'm like, I don't know. I didn't have this just like moment where I woke up in the morning. I was like, oh, I'm so gay. Like, so just kind of tell us like, when did you start to kind of feel like, oh, maybe something's a little bit different about me. Maybe I feel like what I'm feeling and how I'm presenting outwardly is not really matching up. So yeah, talk to us about that.
Yeah, that's valid. So basically, like growing up, as you stated, I grew up in I went to Catholic school for a little bit until that closed down. Even like my earliest moments I can remember from childhood are probably around like kindergarten, just like some moments here and there. The ones that really stand out is more just about going to Catholic school. Like the girls kind of have to wear like skirts and everything, and you had to dress a certain way. You have a uniform and stuff. I personally would refuse to wear that skirt. I always wore pants or shorts, like whatever the boys were wearing, I would wear that plus the polo or a t-shirt. One day, like I know the nun wasn't the biggest fan of me because I went against this norm of not wearing the uniform. She was a big fan of my brother, but me, it was like a little different just because I could not wear that. I did get in like a few arguments with my mother growing up just due to like having to wear, not wanting to wear um, dresses and skirts like for special occasions. Like we would get in some arguments. It's not that she would force me to wear certain things. It's just more like for those special occasions, she wanted me to dress accordingly. And I just couldn't do it. I would have meltdowns. I would cry. Um, it doesn't seem like it's that big of a deal, but it just really makes sense looking back on my childhood and the way I acted and presented. I always cross-dressed, so I was dressing as a tomboy at the time. I just felt so comfortable wearing those types of clothing, and then I also was mainly friends with all the guys growing up. I was big into sports, so I would be at like playtime playing with them. I wouldn't be like really be playing with like the girls with whatever they were doing, like hopscotch or stuff like that. It just wasn't things that I was really interested in. I played a lot of video games. I hung out with my brother and his friends. I was like latched onto my dad's side a lot. Like my dad and I were pretty close growing up. In a way, it's kind of hard for me just to like kind of come out to him because I felt like I was kind of taking away his little girl from him. So that was like really difficult for me. But there's never like a time where I knew that I was transgender. I didn't even know what like being trans was until high school, like senior year of high school. But there's definitely times throughout my life, especially puberty and stuff, where I just struggled so much going through like changes and like being different. I was definitely an outsider outside of like all of my friends and stuff. I couldn't really talk about how I was feeling with my friends. I couldn't relate to anyone. And then it was very difficult. Like I didn't really open up to my mom about stuff either. I just didn't want to be a burden on her, basically. Um, so yeah, there's never like really a time where I was like, oh yeah, I'm definitely trans. But like there's definitely moments throughout my childhood where it just really makes sense if you go down the line as to like
Right.
where
In
I'm at now.
hindsight.
Yeah,
Right. In
exactly.
hindsight, you can look back on those things. And I totally relate to what you're saying as far as your parents like not wanting to be like a burden or change the way that they view you if you had the certain relationship. And I
Mhm.
think what you were saying, how it may not seem like a big deal, just the way you're wanting to dress, it may not seem like one, but it is, that's how people, it's one way we express ourselves is through the way we dress and through the way we outwardly present ourselves to the world. And I think what people may not understand is even just looking in the mirror and or seeing a picture of you dressing how you want or just like feeling good that way, it makes a huge difference on just the way you view yourself and your confidence in the way that you portray yourself into the world. So I
Mhm.
think it sounds like at an early age you, like I said, you maybe didn't have the intellect to be like, I feel like I'm identifying a certain way, but you did know like there was something, like something was not feeling aligning as to what the typical little girl is supposed to be doing, right?
Yeah, exactly. I had like a lot of internal thoughts that I kind of pushed down until obviously eventually I couldn't hold them down anymore.
Yeah. Oh my gosh, I totally relate to that. So yeah, you say you came out in 2017. So how does that look for you? Like, how did you confide in a couple people first? Because for me personally, I didn't come out as gay until I was 24. 23, 24, and I'm 29 now. So I understand that part. And for me, it was I confided in a couple people finally. I had never spoken a word of it till I was literally probably 23. Is when I first told a couple people in my life. So is that kind of how it started for you? Like slowly started to tell people you trusted? Were your parents someone that people you were able to confide in from the beginning, or how did that go for you?
Yeah, so I technically came out twice, per se. Like I came out as a lesbian at first, and I couldn't really connect with the terminology of or the label a lesbian because internally I felt like I was just like straight. Um, that's like a different conversation, I guess. But I came out as gay when I was 18. It was still 2017. It's the same year. And then I came out to just like my close friends. It's not like I really had to come out because I would say everybody already knew that I was like attracted to girls and everything just based off like how I dressed and everything. Um, you could assume that, but then I came out as trans a few months later to my best friend Claire Leo, and then I had a girlfriend at the time, so I told her. And after that is when I couldn't like physically tell my parents. It was just too hard of a conversation to kind of have. So I'm definitely better with getting my words out as a writer, I feel. It's just easier for me. So I wrote a letter on the computer. I printed that out for my mom to read before she went to bed that night. And then she actually came out to my dad for me because I just couldn't. So I'm assuming we haven't really had that conversation, but like I'm assuming she shared the letter and just like explained what was going on in a way. So
And this was 2017.
yeah, 2017, all of
And how
this.
old were you?
I was 18.
You were 18.
Yeah,
Okay.
as a
Yeah.
senior in high school.
Okay. I really relate to that part as well because I also did not know how to put this into words. And I think for me too, I didn't want to, my parents specifically, I didn't want to know their reactions. Like I didn't want to see their faces like before, like whenever I told them. I grew up in a very like, small conservative town. It just wasn't normal to be gay. Even to them, just their view of the world, they still to this day where they live just don't see that as often. So I literally sent them text messages just to tell them, and was at the end of my message, I just was like, when you want to talk to me, just call me. I don't want to see that reaction,
Mhm.
and not to like put them down or any fault of them. That was on me. That was just something I didn't want to have to face or see. And also, I think I put things better into words as well, writing it down versus trying to like verbally process it. Yeah, let's kind of talk about. So, how did you? Well, first of all, I guess my question is, when you came out as transgender, was there somebody that you saw that you were like, oh, that's how I feel, or was it just something that you just knew inside of you? Like, how did you come to that conclusion of like that's how I'm feeling, that's how I'm identifying?
So there's two, like, I guess you could say influencers in the trans community at that time that I like just stumbled across randomly. One was Sam Collins, he's on YouTube, and I ended up just like going through his social media, like deep diving on stuff, and then I came across someone else named Wes Tucker. He's not really as open in regards to like his journey and stuff, but like just knowing that he's transgender and like he looks like that, like I looked up to him in a way because I was like, I want to like go through this process and literally look like this guy. So I basically went on like a rampage of research, like every single night on YouTube, just Googling everything, just trying to learn more about stuff. I'm big into doing my own research and just trying to figure things out for myself, until I actually share the facts with like other people because I want to make sure like this is truly like what I want to do and like what I identify as and stuff, and just like it falls into line with how I'm feeling too.
Gotcha. So how did you so the first steps that you're taking to make this transition, when exactly did that start and how does that work? Do you go to your primary care and say this is what I'm wanting to do and they refer you? How does the very beginning first stages of transitioning, how does it work?
So it really depends. Everyone's like journey is different, obviously. Like you're not gonna go down the same road that I went about it. For me, I lined it up in regards to what was most important. So I figured out like I wanted to get on hormones first and then I wanted top surgery. Like those were the top two things. And then I knew like bottom surgery was definitely something I wanted, but that's gonna be, like, the last step because that's probably the most, like, intensive thing to go through, which it was. So for getting on hormones and stuff, I had to find a primary doctor, and then I also needed, like you need, like, letters from a mental health specialist, so I went to therapy for a couple months just to make sure, like, I am, like, struggling with gender dysphoria and stuff like that, that I am transgender. And I did that. I acquired some letters from therapists along the way, and then I was able to kind of get on hormones. But I didn't start like my journey until 2019. So I came out in 2017 and I gave myself, but also like the people in my corner, a grace period to kind of like understand what I was about to do.
Gotcha. Okay. So you go to the therapy, you get the documentation you need, and then you go to your provider and they started you on, was it just testosterone? Then you start that process before you do any kind of top surgery.
Yeah, so I went on testosterone. You don't need to go on testosterone to get top surgery.
Mhm.
That's just the way I went about it. I went on testosterone, and then right after, I was during this time period, I was figuring out like legally changing my name on everything. So that was a process in itself during this time. And then on top of that, I was looking for a surgeon for top surgery during this year and just like setting up consultation with them, figuring out like things were going to align correctly in regards to what I was looking for, and that he was gonna take care of me and do a good job, basically.
Yeah. Yeah. I mean, that's important,
Yeah.
obviously. So when you first start taking, I'm just curious, like when how did it feel when you first started taking testosterone? Like what kind of, I don't even know if you call them symptoms, but what kind of changes were you experiencing that you were like, well, this is wild, or was there any, or was it just kind of like, oh, I start getting a little bit, maybe more hair, or what were those big differences?
Yeah, I was extremely nervous to get on testosterone. That's also, like, another reason why I pushed it off for a little bit, just, I really wanted to make sure, like, this is what I wanted to do.
Yeah. Yeah.
Um, so, eventually, when I got my first shot, like, they showed me how to do it myself because I do it every single Friday. Um, I didn't feel any like I was excited after the fact, but I didn't like start to notice changes until probably a month in. I would say like the first change I started to notice was just like my appetite. I started to become like extremely hungry. It's you're basically going through puberty like a teenage boy.
Yeah, that's what I was
So
about to I literally was about
yeah.
what I was about to say was it's probably just like that teenage boy, like, you're just ravenous, like yeah.
Yeah, that's literally what it's like, and then I would say the first 3 months, one of the first physical changes is, like, your clitoris, like, grows when you're on testosterone, especially, like, if women take steroids too, like, their clitoris is going to grow.
Really? Wow.
That was, like, one of the first physical changes, and then my voice started cracking a little bit more, and within, like, a 2-year grace period is when it started to drop here and there, but I would say
Okay.
it's definitely the appetite, and then the physical change was my bottom area started to grow a little bit.
Yeah, yeah. So when you, were you at this point, you were 20 when you started, correct? Is that how am I getting that timeline correct? It was 2019?
Yes. Yeah,
Okay. Okay, so were you in college, or what stage in life were you in? And that's one of my questions, and kind of off topic of that, and you don't I'm not asking you to, like, give us numbers, but is this something that insurance helps with, or is this something that's all out of pocket?
so insurance for me is I've had great insurance. I've been on my mom's plan, like, under 26. I'm 26 now, so I've
Yeah.
been on my own for, like, a year or 2, but I was on my mom's during this time. I was in college. I was going into my junior year when I started testosterone. So I was basically transitioning while I was in the midst of college.
Wow.
Yeah.
How was that socially? Because
That
so you started college, and then you started this transition. Yeah, that must have been was that hard in your social circle, or
that was pretty hard. I did go to, like, one college, and I transferred to another college my 2nd year, my sophomore year. So I played basketball my sophomore year at this college. I had a good group of, like, girls behind me, a lot of friends, I would say. A social life was pretty good, and I already came out, obviously, in 2017 because I published, like, a YouTube video just to publicly come out. I thought that was the easiest way for me to do it. Um, so that was out there in the world, and obviously, like, all of us being on social media, like, they came across that eventually. We did, like, briefly discuss it, and, like, people asked about it, and, like, they were still so supportive of me, so I thought that was very cool, and they just made me feel extremely comfortable in whatever setting I was. So I really respect and appreciate, like, all of my college friends because they were going through the transition with me, during this time, so they were definitely the people that I fell back on during, like, these, like, first 2 years that were probably the most difficult times of my transition, but they were all pretty supportive. It was difficult at first and just, like, getting used to my name change, my pronouns changed, like, they were she to her, and they went to he to him, so it's just like I have an understanding, like, these people are going through the transition with me, it's gonna be difficult for them as well, so I wanted to be, like, pretty, supportive on my side and have them understand, like, I know you're gonna mess up on whatever, but as like, you trying to make these changes and adjustments, like,
that's all it is. It's the
that
trying.
means the world to me, so I
Yeah.
appreciated that.
Yeah, yeah, I think that's huge having, that support, really, and what you're saying, I feel like is great too, is not being so rigid with it, and as long as someone is making that attempt and that effort and trying and seeing you for who you are, I think that's huge. It takes both sides to kind of come together and go through a transition like that, especially people who had known you one way, and then you're transitioning into, your authentic self and feeling who you wanna be. Yeah, I think that's important to have kind of both sides there. Um, so let's kind of dive in. Were you documenting this on social media from the very beginning, or did you kind of hop in and do it as you were like, where did you get that idea to start documenting all of it?
Yeah, so I wasn't really doing it in the beginning, I would say I started to really document it, like, maybe I slowly started to post on TikTok, like, I don't know, my 2nd year, like, towards the end of my senior year of college, and I started to receive I was growing a little bit of a following, but then I was receiving so much hate that I couldn't, like, really take it at that point. I wasn't as confident, I would say. So I ended up, like, deleting that account, and then I did start over again, with the TikTok that I have now, and I've been doing it ever since, like, probably 2021, 2022. So,
Okay.
yeah.
So a couple years in. Yeah, that's one of the hardest things about social media is just the hate that people get. And I can imagine you're going through this transition that you're already very vulnerable and all these changes, and to have people feeding your head full of these hate comments and just anything is probably, it's just all noise, and trying to process all of that is probably like near impossible, while trying to like keep your own mental health in line.
Yeah, 100%. My mental health was probably not in the best spot to be able to, like, be as vulnerable as I was, so it definitely needed some time to work on that.
Yeah, yeah, I feel that. So you're okay, so I'm trying to get the timeline straight here. So you did the testosterone, and then at what point, after how long were you on that before you then decided to do the top surgery? And then talk to us about that. How did that go? How was the recovery? Did you have to be hospitalized? Was this all outpatient appointments? How was that?
Yeah, so 2017 I came out, 2019 I started testosterone, and then I legally changed my name during this year as well. 2020, right before COVID, I was able to squeeze in my top surgery, so I was grateful for that aspect. So it was just like I went in the hospital, I got top surgery, and then I was out of the hospital like same day, and I was just resting and recovering during this time period, and then I was going to my surgeon's office, which was like it's a, plastic surgeon, so I was going to his office for just, like, checkups, just making sure things were kinda, like, healing as they should be, but, yeah, I
Is
was
this New
making.
York City, or is this where you live in
No, this is where I
New York?
live, so in
Oh,
Syracuse.
okay.
Mhm.
Okay. So you didn't have to be hospitalized for it. It was just you went and had the procedure, went home.
Yeah, I did not
Okay.
have to be hospitalized.
Okay. And how was was this like a specific to, it was just plastic surgery, so it wasn't specific to um gender transitions, it was just anybody going in for plastic surgery?
Like the way I'm able to get it covered by insurance is that it falls under my gender affirming care. All of the
Mhm.
surgeries I've gotten have fallen under that, which my
Mhm.
insurance does cover. I'm grateful for.
Oh, nice.
So
That's amazing.
that's how I've been able to get everything covered. Um, and just you just need like your mental health letters and just like your doctor letters as well, like notes and stuff.
So how, when you went into this appointment to have this done, how was the staff? Were they accepting of you? Did they ask you questions, or was it just like another day at work for them where they weren't even thinking twice about it? Or did you ever have nurses or doctors during this time that you felt judgment, or maybe they said things to you that were inappropriate? Did you ever have any of that, or no?
I would say no. Like I've been through I'm grateful for my experience, of course. I've been through like so much within such a short amount of time, so I feel like I've kind of like it's all a blur at this point. But my top surgeon, like he's dealt with top surgery for trans individuals for many years. So he made me feel extremely comfortable just in the room himself. He's cracking jokes and stuff, just like complimenting me and just making sure that I was comfortable, which meant a lot to me. And then just the nurse practitioners and stuff, like they were all very nice, very friendly. So I appreciated everything that I've been through with them.
And I feel like that's huge to have, especially when you're going. I mean, that's major. You're going in, for surgery. You're essentially like chopping things off or making it, whatever it is that you're doing as far as the surgery goes. And that goes for really any kind of plastic surgery. I imagine. I've never had it, but not even just like gender transitions. I think that it has to be important to just feel comfortable in the setting that you're going into. So I'm glad that you had that, because I don't think that, I feel like maybe for people that are going in for specifically for gender transitions, I'm sure that these places are mostly accepting of that and making the patients or the clients feel comfortable, or else why would they be doing what they're doing, right?
Yeah, exactly. I think I would say like I was pretty anxious in the beginning stages. So definitely around like top surgery and when I had to get a hysterectomy, I was pretty anxious just to kind of like meet with these people because I wasn't as confident in my
Yeah.
body.
Mhm.
But along the years, as I've gotten more confident, more comfortable in my body, like it's just like, oh, whatever. Like I know there's people out there, especially in this line of work, that probably aren't too educated on the trans side of things when it comes to surgeries like this. So that's why I'm just like a bit lenient when I go into
Mm.
these appointments. I'm just like, oh, maybe this person isn't too knowledgeable on this stuff. So I'm willing to answer whatever questions they have, but also like try to make it so casual of a conversation so that we're both comfortable in the set.
Yeah.
Yeah.
Yeah, I think that goes back to what you were talking about with your friends when you went through this transition is I feel like as long as people are willing to learn and be educated about these topics and not make it seem like it's so taboo or make you feel alienated for who you are. I think again that's like the meeting in the middle from your standpoint being like I understand that you don't know everything about this or you don't know exactly maybe how to approach talking to me, but I'm going to meet you halfway and we can learn from each other on how exactly this works or how to make us feel the most comfortable would be I think the most important in that. So during this you never had any times where you stayed overnight in the hospital.
I did after my hysterectomy, but that's just because like I ended up getting out of my surgery so late that they asked if I wanted to stay overnight. I said, yeah, sure. Uh, but the people that would check up on me, like the nurses that were working the station that night, they were so nice, and like I was just cracking jokes with them because I was bored at that point, and I even eventually I remember I got out of bed and I was, like, asking them if they wanted to hang out, if they had the time because I needed to pass the time, but no, I've basically I think everything that I've been through, it's been a good, like, smooth ride for me, so
Nice. That really is great to hear. So after how long was the recovery from the top surgery, and at what point did you? Because I've seen on your page you've really gotten into fitness. At what point did you start taking that a lot more seriously and start getting a lot more into fitness and health?
yeah, so I played college basketball for a year, and then I started my transition, and after playing ball, I ended up resorting to, like, strength training, lifting, just being in the gym because I really wanted to build the body that I've always imagined. And then going through top surgery, I recovered during COVID. So I recovered for probably a month and a half. And then I started to like integrate some at home workouts because that's all I could do. And then tried to get into running again during this time. And then I slowly got back into the gym. So this is like what, 2020, towards the end of 2020, and then I started to really focus in on my fitness in 2021. Um, I moved down to Florida, and that's when I really like did a heavy bulk, and that's like when I've been able to put on my most muscle mass. And then I took like I got like my certification to be a personal trainer, and that's really when I learned all my knowledge on stuff. And since 2021, like I've really focused on my health and just my fitness because just by doing this, I'm able to build a body that I'm comfortable in and that I'm confident in. And then obviously that just falls into line with everything else in my life and just how I go about my life and carry myself.
Yeah, yeah. How important is it for you to now, like you said, you finally are getting this body that you want, you feel most comfortable in. So how even now when you look in the mirror, do you still catch yourself like, well, that's me. Like I feel so good. How important has that been for you in this process? To be able to look at yourself and just be like, that's me.
Yeah, it's extremely important. I would say just seeing what I look like in the mirror now, I'm actually like, I'm happy of what I'm looking at. Before, it was very hard for me, before my transition, like, I always say this, like, I used to cry to myself because I was not happy with what I was looking at, and I just hated my body and just the image that I was seeing, it just did not fit what I was, like, feeling internally. So being able to internally feel this way and just look at myself and feel this connection, it's very soothing. It's definitely a huge weight lifted off my shoulder, so it's definitely a great feeling. And I also wanna, like, mention you mentioned this earlier, like, I hated how it looks, so I hated taking pictures. Now I love how I look, and I'm taking pictures of myself all the time. People, maybe it comes off as like a little cocky, but in reality, I'm confident with who I am. I've worked hard to be where I'm at today, so I'm not gonna like be afraid to show it off and stuff.
Right, and you should not be. I mean, that's
Mm.
again, that's you are comfortable in your skin and who you are, and especially for somebody like you who spent a lot of your life not. I mean, of course. I mean, flaunt it. You've worked hard for it. You've gone through these. I mean, it's not like these procedures you're going through are just like simple procedures. I mean, they're extensive, and so I think that is great, and I think that anybody out there who's wanting to should feel comfortable posting themselves and all the fitness things that you do without a shirt and all that. It's important for people to see. So talk to us about I know you just recently went through bottom surgery, so I think a lot of people are probably interested, of course, to see or to hear exactly how that works. So do you mind just kind of walking us through that and giving us your experience on how that's been? How many months out are you? So talk to us about it.
Yeah, so honestly, I don't even know where to begin. Bottom surgery for just like trans individuals, there's different types of bottom surgeries that you can like get basically. Um, the main ones are phalloplasty, which is what I went through, or a totioplasty. I'm pronouncing that wrong right now. Um, that's ALT, but that's more in regards to like taking the skin graft from your thigh. I obviously took it from my forearm. That's why I have this big, huge skin graft scar. But I got that done. My first stage was February. Yeah, it was Valentine's Day actually of last year, 2024. And then my surgeries were split up into 3 stages. So I had stage 1 in February 2024, stage 2 in July 2024, and then I just recently had stage 3 in April of 2025. And I've had no major complications. Extremely grateful for that aspect of it. My buddy, I know someone who lives here. He's been going through this surgery as well. He goes to the same surgeon that I go to. Um, He's kinda had a few complications here and there, so obviously everyone's different in regards to like, your body, your age, how healthy you are, just like that's why it's so important to really take care of yourself, especially during, like, these surgeries, just in general, just so you can actually, like, heal up a little quicker, um, but yeah, I don't know really what you wanna get into, there's so much I could talk about, so
Yeah, yeah. Hit the points that you feel are most important. I mean, tell us whatever you want. I mean, I've seen for anybody that's listening, go check out Liam's TikTok and Instagram because you've shared like the actual. It's funny when I was scrolling through, it literally will have like a sensitive topic on it where you have to like click a button in order to see. But yeah, talk to us about like the skin graft. I mean, these are extensive procedures that you were going through. So just talk to us about how that recovery went, how, I mean, that exactly works and why, like, why are they taking it from your forearm? You've talked about, I know you get a lot of questions about sensation and things like that. So just kind of talk to us about it.
yeah, I'll just go in like a deep dive, I guess, with every
Sure, please.
stage. First, my
Yeah.
surgeon was Dr. Bluebon Lagner. She is located in New York City at NYU Langone. Their practice is amazing. 10 out of 10 experience I've had with them. Just my pre-op appointments, my post-op appointments, even staying in the hospital, like all of my nurses were fantastic. So I have like nothing bad to talk about on their part of things. Um, but stage 1 is really the main focus of just taking the skin graft and taking it off from where I had it. I went with my forearm because personally, I talked about this earlier, like yesterday, I posted a video. You just have better nerve endings in your forearm overall compared to like your thigh and stuff. And you're just holding like less fat percentage in your forearm as well. So like the actual result is not going to be as girthy, just like the results I've seen from your thigh. Um, it's kind of hard to take like decent length from your thigh as well. So I told my surgeon like my top 3 requirements mainly is like I wanted it to be as realistic as like a cis man's penis as possible. Standing to pee was definitely in the top 3, just being able to do that. and then also just like the sensation aspect, having sex and stuff. So those are like my top 3 requirements that I expressed to them. Obviously, we discussed what was best for myself. She looked over my body and she said, "Yeah, like I could take like radial forearm free flap is what it's called, taking it from my forearm." So stage 1 is literally taking the skin graft, just transporting porting that down below. Um, the stage 1 is the worst surgery I went through. Recovery-wise is actually insane. I was in
Like the pain, like was it
it
painful?
was painful just in regards to my forearm was painful. I had little use of my arm. My left side of my body was, like, open wounds, so that was difficult to look at mentally, and just having to, like, wash them and touch them, it was very hard at first. I definitely share, like, pictures and everything on my social media with what it looked like to, like, what I look like now. Obviously, it's definitely healed, but, the pain was in my forearm, just I had to learn how to reuse my hand and just my fingers and just doing, like, basic human things. I couldn't brush my teeth, I couldn't eat at all, really. I struggled going to the bathroom, like, I couldn't walk. I was bedridden for about a month. I had little to no movement, so that was very difficult just laying around, and I was in the hospital for 5 days. That was hard alone just because those 5 days, I was basically on a lot of drugs. I was taking Oxy, like, every single day because I just couldn't handle the pain, and I was literally just laying in my hospital bed, didn't really talk to too many people, and, just me being me, I try to push myself, so I was kind of overdoing it. I was fainting a lot in the hospital just because, like, I being bedridden, like, your body's just so used to, like, laying there and just having to get up. Like, I had to, like, shimmy out of bed. You can't, like, hinge at the hips after this surgery, so, like, I had to be as straight as possible, and when you get up, you had to, like, literally rise up like this, so you have, like, nurses helping you, and yeah, it was just, like, a very difficult experience. Um
Was there any moment that you were laying there like, why did I do this? Or was the whole time where you were just like, this is going to be worth it. This is going to be worth it. Like, how was the mentality during
Yeah,
that?
it's the mental aspect I would say is most difficult. I definitely was questioning, like, What did I just do to myself? Why did I do this?" I did have those second thoughts, like, was this worth it for me?" Just looking at my body, looking at my arm is so difficult, and that's really what messed with my mentality on things and just, like, my emotional side of stuff. I think, like, the hardest part was just the mental aspect of stuff, but eventually, like, as time went on, obviously it got easier. It's just the in between stage of stage 1 and stage 2 because stage 1's literally just having the shaft down there, like, it looked like a hot dog, like a coonie.
Mhm.
There's there's nothing else to
Did
it.
you did you have to have like a catheter during this
No, so
or no?
I still had a
Oh.
vagina. So I had my vagina and then also just this shaft sitting down there. After stage 1, like, you had to elevate it for just the blood flow because it's, like, an actual thing that's attached to your body, so you don't want your body to kinda, like, refuse it in a way because it could die, and then you would have to go through surgery again. That's, like, a complication that could happen, so I'm grateful that didn't happen. I was very scared for that. So you had to, like, keep it elevated. I literally just rested it on a pillow as I laid down for a month, and then you have to, like, Coban wrap it. That was so annoying. Just all the post-op stuff that I had to do in regards to it, it was a lot. It was very swollen. So the Coban wrapping definitely helped in regards to keeping the swelling down, but it also helped keep it elevated as well. So just like as I said, like the in-between stage of stage 1 and stage 2 was hard because I still had a vagina and then, like, I was still sitting to pee and everything, but I had this random thing attached to my body that had absolute
Yeah. This new appendage you've
yeah,
never had. Yeah.
and that was another added thing that was hard on top of, like, my arm and my leg and taking care of that and going to, occupational therapy and just trying to relearn how to use just basic movements. So it was a lot after stage 1 and then stage 2. is when like everything else happens in regards to like urethral lengthening, so I can actually change the routing of how I pee. And I had a vaginectomy, so I got rid of my vagina. They closed me up, sewed me up, and gave me scrotoplasty. So I had a scrotum down there, but like there's no testicles in there. It's just like an empty sack. So there was a lot going on in stage 2, and that's when I had like all these tubes inside of me. After the fact, and a catheter and everything, so I was able to actually like stand to pee and actually use my penis after stage 2, which really helped um, with the mental aspect of it. So in between, it was like a 6-month recovery after stage 1. So I didn't really start to feel like myself a little bit until probably month 4 after stage 1. Again, like I wasn't 100% myself after the fact, but the whole year last year is probably the hardest year of my life that I had to go.
Yeah, that is just you telling me that. I'm like, wow, that is mentally like exhausting. That's like that's hard. That's a lot to go through. Um, wow. And I imagine for, I think my thought goes to, I love that you had the resources and were able to do this, but I just think about all the people out there who do have, who are trans, who are don't have the resources to go through the transition, and how difficult that must be just on their self-image. And so I think that I love that there's people like you who are willing to share your story and be so vulnerable and open and talk openly about these things, and not make it, like I said earlier, so taboo or so crazy to talk about. I remember what I was going to ask you earlier when my brain froze was I've seen people have commented to you before about like, why can't you just cross dress? Like, why do you have to go through this whole process? So can you kind of explain to us why? For me, I can imagine it's because you probably kind of already touched on it. It's just like that mind body connection and just the way you actually view yourself. So how do you respond to people who say things like that? Like, oh, like, why couldn't you just be like, why can't you just dress as a boy? Like, why do you have to go through this whole transition?
Yeah, it's like not that easy. Clothes can only do so much. They can only help in regards to the gender dysphoria or the body dysmorphia that I was like experiencing at the time. Just hitting puberty, having a vagina overall, I disassociated from that fact of my life for a while, and I steered clear of like doing anything sexually with stuff, having like with people, having like relationships like that. It was hard. So it's just like cross-dressing can only do so much. Yes, it helps in a way, but like knowing when I had like boobs and everything, having a chest and like knowing that they're there, that's all I fixated on for so long during that time. And just like I had so much anxiety just going out in public. Like, can people notice the fact that I have a chest? Like, nobody's really staring at me in regards to that, but it's just more like I have so much anxiety based around like if people can notice that I'm a female. I hated like knowing that people could know that I was female, but inside, like, I wanted to present and like be a man so bad. Uh, During
Yeah.
middle school, I printed out like pictures of like all these actors, like some of them were shirtless and stuff, and I put them up on my wall. Um, I used it as a way to like maybe trick my parents, thinking like I'm attracted to men, but realistically, I wanted to look like them. Uh,
Yeah. Yeah.
I always yeah, I always had an image of what I wanted to look like, and it was always this, like, toned, muscular guy. It's just, like, a lot deeper. It's, like, a deeper conversation that I have to have with these types of people. Like, and I feel like a lot of them just don't truly understand, which is okay, but it's just not that easy. Like, there's all these internal facts and, like, things that I was experiencing that were a lot deeper than just, like, wearing a certain type of clothing.
Yeah, and usually people asking these kinds of questions usually are, it's no matter what you say, they're not going to receive it. They're going to have something else to say to combat like what you're saying. Um, and so yeah, and I imagine too, like we're saying, your clothes can only do so much. Yes, it helps. It's a form of expression, but at the end of the day, if you're trying to be, intimate with somebody and you're not happy with your body and just, don't even want to see yourself that way, I can imagine it's really difficult to be intimate with somebody if you can't even feel that just like comfort in your own body in those kind of situations.
Yeah, it definitely affected like different aspects of my life. So it kind of sucks just like being younger, especially going through college and stuff. With me, like I'm not one for like hookup culture at all. I feel like a lot of people
Hmm.
just see me on social media and like my personality, they might think like I am into that or I'm a player in a way, just how I carry myself. But realistically, like I'm a huge lover boy. I'm definitely more of someone who wants to have like an emotional attachment with someone, just like that type of relationship, just really get to know someone and have like a comfortable setting with them. I have to be comfortable with someone in order to actually go through any type of like sexual relationship with like anybody.
Yeah.
I'm not willing to just get with anyone just because like I care about a number. Like I don't care about that. I care about like really connecting with an individual and just like going through something like that with them is like pretty important for me. So
And I feel like it's for really any woman out there would be, so lucky to be with you in the sense of you. I feel like you have a perception that most men don't because you know what it's like to be in a woman's body. And, you can kind of understand that perspective. Is that right? Or,
yeah, I feel like that's pretty right. I mean, a lot of my guy friends are very respectful and everything, of course, but I just think the way I go about my relationships is a little different. Just like emotional intimacy is just so important. I just want to get to know the individual, and I'm pretty picky, I would say, in regards to like the dating aspect of things. But yeah,
yeah, that's good. I think
I
that's a
I've
good
been
thing.
through a lot, so I feel like I kind of know what
You should
my
be.
worth is, and like my standards in a way.
Yeah, yeah. I think it's again what I think is so important about people hearing your story going through this is it's not like nobody would choose to just go through this just because. Like there's obviously a huge why and a huge reason behind why you are willing to go through these. Again, these are such extensive procedures and the recovery and the mental aspect that you're talking about that you've had to go through and the risks. Like you have to really feel that this, like the body you were born into was not the body that was meant for
Hmm.
you. And so I really do applaud you for being so vulnerable and being so willing to, first of all, go through that. And then second of all, share it with people. I had seen something you had posted before, and I'm kind of curious to hear you talk about it, of how I think it was your, correct me if I'm wrong, it was your mom who had asked you if it was okay to have pictures of you from when you were a kid still kind of hanging up in the house. So how is it for you when you look at pictures of you as a child, or you see these pictures in your house? How do you respond to that? How do you look at that version of you and do that like inner child healing and hold them closely? Like how does that feel for you?
I love looking at pictures of myself as a child. I love watching like home videos that we have as well. Like I'm very well aware of who I was and who I am. Like I'm still the same person. Obviously, it just doesn't really match on the outside perspective of things, but deep down, like my personality's never changed. I'm just able to kind of like show it a little bit more just because I'm comfortable again in my body. But yeah, I did ask my mom, like, well, my mom asked me, which I really respected on her end, just making sure like I was comfortable with that. I'm like, yeah, those are like not only my memories, but those are also her memories as well. So I want her to be
Right.
able to do whatever she wants with them. I'm totally cool with it. And I don't know, I have like nothing good to say like on my, I mean, I have nothing but like good things to say
Good things to
about
say.
my
Yeah.
past and just like my childhood overall. I cherish my memories and everything I've been through.
Yeah, yeah. I love it. That's great. Okay, so again, I want to be very respectful of your time. Is there anything you want to leave the audience with? Again, this is a podcast called Club Nurse. It's on the Nurse.org network. Is there anything that you would give us, the nursing community, any way for us to better care for people of the trans community? Even if you're just going into the ER for something, is it better to not even like if somebody comes in and if you go into the emergency department and again you're just there for whatever reason, how best can a nurse or a doctor or anybody in healthcare best support the trans community?
For me personally, I think it's just treating me as any other individual, which mainly all of them have.
Hmm.
I know some have definitely like asked questions, and just me being me, I'm open to it, but like other people might not be. So really it's just like more respecting them as a person, um, just showing them that they're like anybody
Human.
else. Yeah, they're human. That's like
Yeah.
the easiest way to put it. I feel like there's a lot of nurses that come into my DMs and stuff and say they've learned a lot from what I've been able to share, which I'm grateful for. It's just like I know there's a good amount out there that aren't too knowledgeable on this type of stuff, but it really just comes down to like treating us as people, because we
Yeah.
are.
Yeah. Well, they don't, that's the thing is we don't learn about, I mean, I don't know how it is now. I've graduated nursing school in
With
2018. I mean, we didn't learn about anything that had to do with like gender transitioning surgeries or anything along those lines. So it is up to people like you and social media for us to see that and understand how best to serve the community. I've had patients come. I work in the ER,
Okay.
and I've had patients come in who were going through transitions that are having complications from things or and I just always like wonder how best to make them comfortable. So that's helpful. Just treat them like anybody else, just as a human, and see them as a human, and not, again, like we talked about earlier, alienate them because of what they're going through. I think is the best way to treat people, and that really goes for anybody, in my opinion. So thank you for that. And is there anything else you'd like to leave? Any parting words? How can we find you on social media? How can people follow your journey?
I
Yeah.
mean, yeah, I'm on social media, obviously. Instagram's just Liam Lazore. TikTok's Liam Laz 23. I would say I share so much on both platforms, so it really depends on like whatever people are looking to get into, whether it be you're trans or not. I just try to like inspire other people, provide like comfort in a way, just knowing like you are valid as in regards to like whatever it is that you're feeling. But the biggest thing is just patience is what I always advise to anybody. I've learned a lot, I've gone through a lot, and time is everything. Time heals all. I've had to really take a step back and figure out who I was during all of this. So it really is like you want so much to get done, but you can only control so much. So it really is comes down to like patience and just trusting the process. And yeah, everything does fall into line. So patience is key.
Yeah, I love it. Well, thank you so much, Liam. I appreciate you sharing your story with us here. And yeah, just thank you for being here, and thank you for being such a light in the world.
Absolutely appreciate you for having me on.